We will go ahead and get started. Let me ask, does anybody have any announcements or anything happening in their world that they would like to share with us?
Well, if nobody else has any announcements, I've got a couple. Just to follow up, the response has been tremendous to our first schizophrenia conference that's coming up. We're grateful for everybody that's expressed an interest. The website for registration is uams.health/odyssey. And we have an excellent agenda that's been set up, and I look forward to all of you learning, seeing more about it, hearing more about it. We knew there was a need out there and for more education and more information, and the response has just been really tremendous right off the bat. That's September 27th here on the campus at UAMS, uams.health/Odyssey is how you can access the website for registration and more information. On October 9th, we're going to be hosting a conversation with Sam Quinones and also a panel discussion with some local nonprofits. Sam Quinones is an author who has written extensively. He's a journalist that's written columns for one publication after another from one end of the country to the other. And he has also written two books. One book called Dreamland, which deals with the opioid crisis, and the other, The Least of Us, which deals with the fentanyl and methamphetamine crisis. And the thing that's so exciting about having Sam come here and hearing him speak, Sam writes in such a way that if he describes a scene, you almost feel like you're there. If he describes something as hot and dry, you're sweating and you're looking for something to drink. Okay, he's a great writer and he defines problems very well, but he doesn't stay there. He also provides that same realistic and pragmatic writing style to solutions. And so based on his writing style is how we have formatted the day. And that's going to be on October 9th, downtown at the Ron Robinson Theater there at the library. More information to come, but I just want y'all to hold that date and that time on your calendar. And I've taken up too much time, and I think Dr. Dean is here now. I thought I saw her.
Hey, Michael, would you say that time again?
On October 9th, it'll be from 8:30 until 11:30.
Okay. AM, I assume.
We'll send that information out with the minutes.
Thank you, Misty.
You bet. And I just put the link for the schizophrenia conference in the chat.
Great. Well, you
Awesome.
found the long one. Okay. Click on that one. That'd be great.
Misty keeps us organized. Thank you, Misty.
Thank you, Misty.
And thank you, Michael, for all the wonderful announcements. Lots happening at UAMS. So I plan on attending.
Thank you, Kim. And just so everybody knows, we're in the process of getting continuing education credits. We've submitted our application for that and for the September 27th event. And then both events are free.
Wow. That's
so
fantastic.
You can bring a friend, but you both have to register. So
okay. Fantastic. Any limit on
any limit on
capacity? How many people you can have?
Both auditoriums. We have the auditorium where we're having the first event seats 217, and we have also registered, we've reserved a second conference room that's of equal size because of just some of the feedback we've already had. And then for the event on October 9th, the Ron Robinson Theater there holds almost 300 total.
Oh, wow.
So there's room for you and your friend. And so there you have it.
Fantastic. Well, I know the ABIN team is excited and we've got folks that are planning to come. So thank you again for offering this.
Well, thank you for letting me announce it, and I'll be quiet now.
No worries. And I see we've got Dr. Hudson, Teresa Hudson, on with us as well.
Hi, everybody.
Hello. I I'm just gonna give a couple of brief announcements on the executive committee. And folks that were on that call, please help me with that. We've sent out the agenda. We'll talk briefly about those updates. We've got David Jones, and he's the Medicaid representative. He won't be here today. He is out of the office, so he let us know. So our apologies. We won't be getting an update, but I think that maybe Teresa could possibly give us some information, and then we'll have Tisha, who will give us an update on UAMS. And then Dr. Gibson is unable to be here today. However, she was going to talk a little bit on the difference between models and programs, because anytime we're thinking about and talking about implementing models such as CoCM, there's lots of different moving pieces and it becomes really intricate and challenging. And so I think it's important to talk a little bit about some of the evidence-based components. So that will be a little bit about what we do today. So with that, I will start with, we did have our executive committee meeting this past Monday. And at that meeting, Teresa was able to give us an update on the project. We also had a nice discussion talking about what are some of the strengths and progress that we're making in this project, as well as what are some of the challenges. And we're still fairly early in this implementation process. We haven't really gotten patients enrolled in CoCM models, and so we're still laying the foundation and really working hard on the foundational pieces. Wanted to let you know that we did have Dr. Verna Little, and Dr. Little, she has done 2 different trainings for us. The first training was really laying the groundwork on what is CoCM, what are the needed components, what are the roles of the care team, and then the second piece, we started diving into the billing piece. And so the billing training was really good. And there are lots of great questions about the billing piece. And I anticipate we'll be working on the billing pieces probably the duration of the project. So CMS makes the billing pieces look so easy. However, when you get into different categories of what type of site is this? Is this an FQHC? There are different codes, CPT codes, and billing codes for FQHCs and RHCs. What codes can be used when? Things start to get tricky. What type of contract do I have? And what does the reimbursement look like? And what's allowed? And so anyway, we're diving into all of those different pieces and lots of great discussion that we've had at those 2 trainings. We'll have our 3rd training. I
July
want to
24th.
thank you, Caitlin.
You're
You
welcome.
know, I've been putting myself ahead a week all month. It could be the holiday, but we will be having that July 24th. So Caitlin will talk a little bit more about that. All of these are recorded and they're posted to the website. So we're very, very happy to say that if you are like the rest of us on our ABIN team, oftentimes we go back to those recordings, we refer to them. There are pieces of information that are really key and that we want to circle back to. We also want to remind everyone that the end of this first project year is September 29th. So please know we are moving into the last 2.5 months of the project for year 1. Can't believe it. Wow. So I think that's all of the updates. I don't know, Teresa or Tisha, if you have any additional updates from the executive committee meeting that you would like to share?
I don't know that I have a lot of new information, but I did want to just remind I did want to say thank you first for everybody getting their contracts executed. And I'm starting to get a few invoices. And I am, as I think I've told everyone, we're working on figuring out how to get, not figuring out, we're working on the process of requesting a carryover. And if you haven't made a request for what you want with the carryover, that's okay. I'm going to assume everyone needs their carryover. And if you're going to do something different other than what you told me, most everybody said they were going to purchase, pay for personnel to do the project. But if you need to request something different, please send that to me. But we're expecting to submit a carryover request so that we can have our funds for next year. I think that's probably the only information, and I can take questions about that process if necessary, or if that's useful. Seems like everybody's pretty good with it. So
Awesome.
I don't have any other requests.
Teresa, how optimistic are you about receiving carryover?
Well, so normally I would say I'm not too worried, but there are 2 caveats, because in the past I've been successful with requesting carryover and getting it from SAMHSA. However, this project seems to defy all logic. It just seems to be they're asking for things that I haven't had before from SAMHSA. But that said, we are using what we're proposing so far is very much within what the SAMHSA normally approves. So I think as long as we have a good spend plan, I'm reasonably optimistic. And the state indicates that they will support a request, because the way this grant is structured, the state will actually be the one submitting the request. So I'm reasonably optimistic. So we will see.
Great, thanks.
We'll take that, Teresa. That's that's positive. That's what we want. Okay. So David is not here, but I think that that's probably a good enough report. Teresa is saying that on behalf of the state, she'll prepare the carryover and that will happen this fall. With that, oh wow, a lot's been happening in the CoCM world. I see as I'm looking at Tisha, I know that you sent out the 20th anniversary webinar that Ames did, and I can't remember if it was yesterday or the day before. The days are running together this week. But I have to say, for anyone who is interested in CoCM, and if you were not able to be on the call, it was absolutely wonderful to hear from Dr. Jürgen Unitzer, who really is seen as the one of the pioneers of CoCM. He recognized Dr. Wayne Caton, who started really, he gave credit to starting this program. And then Dr. Anna Ratzliff was on, and she was giving credit to Dr. Unitzer for mentoring her, gosh, almost 20 years for this work. And so that was fantastic to get to see them and to see really the camaraderie, to hear the story from them in their own words, and really to hear about the great things that they're doing and all of the work that and potential work that they see. They also talked a little bit about AI and what does AI look like potentially in the CoCM space. With that, yesterday we had Dr. Scott Breitinger on our ABIN webinar, and he is an associate faculty professor at the Mayo Clinic in the Department of Psychiatry. And he was talking about addressing mental health in the digital health space. He also was talking about how using technology could be an avenue in the future to support CoCM. And so it was really exciting to hear from him. He's doing some early work at Mayo on some different projects that could be looking at how do we use and leverage technology to advance CoCM components. So there's lots of virtual components we know with CoCM. So please know that that webinar is also available on our website if you are interested in hearing about that and have interest in how digital health might be able to support addressing mental health issues. With that, I'll pause. And as I said, David Jones is out today, and we'll hear from Tisha on the UAMS update.
Hello. Sorry I was late. Living in the world of now in-person meetings and virtual meetings that do not give you transition time. And in-person meetings always run over. So thanks, Kim, for all of that. We have some incredibly exciting news. We have officially hired and onboarded 2 behavioral health care managers. They started Monday. Their names are Jennifer Conway and Khadijah Simmons, and they are magnificent, and I'm so excited about having them on board. Yay! Jennifer has a background in community health worker as a community health worker, and she was a manager at Bass Pro Shop. She lives in Northwest Arkansas. Actually, is going to be working remotely from home for now, and so she is joined us, and we're so excited. And then Khadijah Simmons is she has her bachelor's in social work, and she was in the military for 7 years, and then has experience in early childhood development, working in daycare. So she's got a great, amazing background too, and she is actually here in Central Arkansas with us, but we are incredibly excited to have them, and hopefully they will pave the way for a smoother hiring going forward. We had to really cut our teeth on this process. But that is my two biggest exciting things to say. Another thing is we have a new psychology intern. So this is the intern switch every time. Madison Ellison, who is on. I invited her to listen in today, and she's really interested in working as a psychologist in primary care, and is really interested in learning more about collaborative care. And so she'll be helping us in developing this program and learning right alongside us. So, and if anybody has any other questions about where we are at UMS, I'm happy to answer them, but I'm sticking to the good news today.
That's exciting, Tisha. Congratulations. You've got those BHCMs hired. And
yeah, and given the great money that we have, it was great. We could bring Jennifer here and have both of them on campus, and did some in-person getting to know them on Tuesday. And then Wednesday, we all hopped in a UAMS car and we drove to Batesville, and we had a site visit at Batesville and got to see that clinic, and that was really fun. And then Kathy Emons has an interview with a possible behavioral care manager or behavioral health consultant in Pine Bluff, and so Khadijah went with her to Pine Bluff today. So we've already stuck them. We're taking them on the road. So
awesome. Look at you. That's great. And welcome, Madison.
yes.
Thank you. Hello, everybody.
We're so glad you're here. Would you like to tell us a little bit about yourself?
Sure. Sorry, let me turn my camera on really quick. Hello. Yeah, so I am the new healthcare psychology intern at UAMS, doing a couple of days rotation with Dr. Dean on primary care, which is my favorite thing to do. I'm really excited about that. But I am from West Virginia at Marshall University, a doctoral candidate in their PsyD program. So this is my internship to finish that up. So thanks for letting me watch, and I'm happy to be here.
Well, congratulations and welcome to Arkansas.
Thank you so much.
Yeah, and this may sound familiar to you, Teresa, but Madison is really interested in rural mental health and rural primary care mental health. So
we need all the help we can get in that space.
Yeah, I said I was happy to hear that because she's come to the right place. Because this is important in Arkansas.
Absolutely. Absolutely. Okay, well, wow, exciting news. That's fantastic. You guys are rolling. All right. So, Dr. Gibson is not here. We were going to talk a little bit about the difference between programs and models, especially related to behavioral health. And so I will take a stab at that. However, we'll probably want to do a little more of an in-depth presentation because I'd like to also get her input next time, but wanted to let everyone know that we are having our CoCM office hours starting next Friday, July 19th from 12 to 1 p.m. And those will be drop-in hours. You're more than welcome to stay the whole time. But if you know of any primary care clinics or anyone who is interested in collaborative care, has questions about collaborative care, and would like an opportunity to ask questions and have some multidisciplinary team members there ready to answer their questions. We'll be doing that next Friday. I am proud to say Caitlin forwarded me an email that we had someone from McGee reaching out today asking about office hours. And so that's fantastic. We're already getting some interested participants. We know that Ames does implementation hours, as well as financing hours. And I can say I've been on a lot of those implementation hours and finance hours to listen to them and hear what they do and see how it works. And we're excited to start that here in Arkansas. We can say, and we always say we're lifelong learners and we may not have all of the answers, but if we do not have the answers, we will get them to you and provide you with the information via email, and keep the conversations going. So next Friday, the 19th, 12 to 1, anybody that you know of that you could think about who might have questions or be interested in CoCM, send them our way. Caitlin, I'm going to let you talk a little bit more about that.
Yeah, you covered it really well. I just wanted to point out that the office hours are brand new. So we're still trying to learn how to invite people to those without having to have them register and do a whole bunch of like laborious tasks along with it. We just want it to be a very relaxed environment where you can just drop in if you want to. So if you are on this call and haven't got one of the emails that we have sent out about it, please, I'm going to put my email in the chat. Please email me so I can put you on that mailing list. And you can see we are redoing this room behind me, and I have all the blur is not working today, so I apologize for that. But and also all my junk's back there. Anyways, just like I said, we're just learning how we want to structure these. So please, if you want to be invited to those and get on the mailing list, just send me an email.
Perfect. And we know you're in the process of remodeling your home office, so don't worry, Caitlin.
Yes, I'm trying, but doesn't make good for a nice calm background back there.
That's awesome. Any questions about CoCM office hours? And I have to give a shout out, Mary Beth. I think that you're on the call. I just wanted to say thank you for offering to put the office hour information in the AAFP newsletter. This will be a way that we can reach a lot of primary care clinics in Arkansas and let them know that these office hours are happening. And we hear often that people are interested in, starting the process of moving into implementing some of these different models into their practices, but it can be really challenging. Sometimes it's where do we start? And so, Mary Beth, thank you for supporting this work and putting this in your newsletter.
Well, you are most welcome. I appreciate all y'all do and keeping us in the loop too.
Thank you. All right. And one of the things that we thought about and talked about is sometimes as we're moving into implementation of a model like collaborative care, it can feel really slow and it can feel like we're walking in the quicksand. And we know that it's because when we're implementing models that are evidence-based, there are specific frameworks that are part of those models. And so one of the things is we're trying to look at and make sure in this project that all of those are in place, that we have a firm groundwork before we get started. And so for me, I think that it's important because we've really been working on BHI for a while in Arkansas. We started talking about it in CPC, CPC Plus. now, we've moved to grant opportunities. And so we know a lot of you are still participating in those value-based programs. Now there's an opportunity to participate in this grant. But it's really important that we think about theoretical frameworks are essential to implementing these models, and they take time. And there are different components that are needed. And so specifically for CoCM, it's based on the importance of using screeners and assessment tools. So, and Verna's not on today, but I asked her this question in one of our trainings as we were talking to Dr. Sideri. It's important for us to start thinking of, especially in CoCM model, could we start to think about screening as a universal mental health vital sign? And so just wanted to throw that out there. Screening is an important first step. We also know that using the registry is a key piece of this. We know that as we're hiring and bringing on our BHCMs, we need them to feel comfortable in using evidence-based interventions. So problem-solving therapy. We've heard Verna talk about CBT skills. Actually, instead of therapy, if we're not talking about licensed clinicians, we could talk about problem-solving skills. We could talk about behavioral activation, motivational interviewing, all of those different pieces. And so, anyway, just wanted to talk about that. It's important as we're starting to think about these frameworks. And then when we think about programming, it's really the implementation of these different pieces from the models within the healthcare system. And so one of the things, and I think one of the things that's really exciting about this project is it gives us an opportunity with the grant to really have fidelity to the CoCM model, because sometimes there might be missing components that can be challenging to try to bring in to programming. And so this grant gives us an opportunity to really have fidelity to the CoCM model. And with that, I'm going to stop and ask, does anyone have any thoughts about that? Thoughts about programming versus models? And
Well, I'd like, the way I kind of conceptualize it is that the models are the theoretical evidence base that we've tested. We know it works because we've got the research on it. And a program is, how do we take this model and we apply it and we adapt it to our setting? We don't want to take away the pieces that make it evidence-based, but we also know that most places can't and don't want to do things in exactly the way that it was designed for research. Research is designed in a way that helps you to get, enroll patients, get the information as easily as possible, and it's not always conducive to clinical practice. But you also, if you stray too far from the way that it's been tested, then you have the possibility that now what you're doing is not evidence-based. So like in psychology, we think about, like, we have protocols for psychotherapy. Like, these are the things that we know, if somebody does this over 12 weeks and we do all these pieces, then we've shown that people get better. But we know every person is a different human. And so if I just go in and start reading a manual to them and making them to do handouts and don't tailor it to the person, then I'm likely not going to be very effective. So it's kind of that push and pull.
No, absolutely. I think it's also important to know, and I'm just thinking specifically about this model, the CoCM model. There's these essential pieces, and so sometimes when we're working with different primary care practices, they might have missing components, such as a registry or so we're excited that with this grant, there's the opportunity to bring in those essential components for the model, for the CoCM model, and to provide training on these evidence-based interventions, such as problem-solving techniques, behavioral activation, motivational interviewing, CBT skills or CBT therapy, depending on the person's ability to, to bill. One of the things, and as we present these different CoCM webinars, people ask, well, if someone's not independently licensed, how are they going to be providing CBT or problem solving therapy? And one of the things that I love is often I'll hear back from our SME experts and say, well, it's actually more teaching the skills. And so those are the components that we're hearing. But I think with the grant, we have the opportunity to make sure we have the different components that are important to have fidelity to CoCM models. So, but you're right. Once we get to real life, there's a push-pull, and sometimes there's limited resources. And how do we adapt? And especially as we're starting to think about, we're getting ready to end the first year, and we're thinking about sustainability, or we're in areas of Arkansas where there are workforce shortages and we just don't have the components. And so starting to maybe think futuristically about how can we potentially use some of these, technology and digital health to support us and to expand our reach. So if we have someone living in Northwest Arkansas, they could support a program in Little Rock or potentially a program in Lake Village. So kind of exciting. All right. That's about all I've got. I know Dr. Gibson was gonna talk a little bit more about that, but I don't really think, we talked a little bit about those pieces. Does anybody else have anything CoCM related that they want to talk about? Or would you be willing to share a little bit about what you're doing at your site and how it's going? I know we've got some folks on from Mercy. We've got some folks on from Boston Mountain, Eastern Arkansas.
Well, my name is Mindy, and I am from McGee, Arkansas. We are wanting to implement a CoCM program. We've been talking about it, and we are trying to get everything together to start. Now, as far as a grant or anything like that, I don't know that we have done that part or gotten that far yet, but we are interested and are wanting to see what we can do to get this implemented.
That's exciting. We are so glad you're on this call, Mindy. Are you going to be able to come to the office hours next week?
I'm planning on making that, yes.
Fantastic. So would you mind telling us a little bit about your clinic and your current population?
Yes, I actually am the credentialing manager, health information manager, and business office manager. So I'm kind of out of my league right here. I've always usually come in on the end part of, we're doing this and you need to figure out how to bill it. And so I've not ever been on the startup part of this, but we have a rural health clinic and we are already doing CCM services and we're wanting to offer this in addition to those. Other than that, I mean, we're just a rural little little town. And so we do have this need though, and we are definitely going to try to see what we can do to get this started.
May I ask a question? This is
Sure.
very exciting. So you are an independent pardon me, you're an independently owned clinic, or
We are we're a critical hospital with the rural health clinic is a provider based clinic.
and what's your name again? Not your name, the name of the clinic. I'm sorry.
McGee Hospital and McGee Family Clinic.
Okay, wonderful.
We're
Well,
excited to have you on, Mindy.
Thank you.
We're so glad you're here.
Well, I'm hoping y'all can help me get started so we can get this off the ground.
You're in the right place.
That's what I was gonna say is that's one of the points of the grant is not just, like the clinics that we're working with, but we really want everyone in Arkansas to benefit from the work that's being done. So we're all a little excited that you're here. So
I'm glad that I found y'all.
Caitlin, I appreciate you saying that because most of you know that I wrote this proposal and there was no way to have a big impact, I didn't think, unless we picked some sites and used them as demonstration sites. And then fortunately we were able to contract with ABIN to really be the experts that spread the word and host these kinds of meetings. So having a independent clinic say we're really interested and we want to take advantage of these resources is exciting, and I appreciate Caitlin making that point.
Absolutely. This is wonderful. Okay. Well, Mindy, and please let us know if you are not able to make office hours and we can meet with you separately. We would love to do that.
Yes, ma'am. I am planning on attending and I am hoping to have all of my CCM staff that will be implementing that. I hope to have them able to join that too.
This is really exciting. So let me ask, because we do have some other clinics on. We've got Tisha Dean, who has really been instrumental. She has been starting this at UAMS. We've got Boston Mountain, Eastern Arkansas, Mercy. Don't know who else is on the call. I'm just seeing the faces. Would you all be able to share a little bit maybe of your thoughts or experiences as you were in this beginning phases of thinking about implementation, and anything that you could say that might be really helpful?
And pardon me for interrupting again, Kim. Would it be okay if when people speak, they say a little bit about their official clinic name and what system it might be part of, so that I can understand who people are a little better? Because that's important if I'm gonna, because one of my jobs is to brag about this project. So I want to brag correctly. I mean,
You have to know who's here.
exactly.
So I'll speak just briefly about our program. This is Susan Ward Jones from East Arkansas over in West Memphis. Kind of excited about, we had a conversation with a psychiatrist this morning. They were going to bring on board for 4 hours a week, Dr. Dyson out of Northeast Arkansas, out of Jonesboro. So she's excited. So we're excited to bring her on board. Also, we're interviewing for some care managers. I mean, we just lost one, so we're going to interview for another one. And then also, I won't say we hit a bit of a snag, but, and I'm a provider, so I understand, but we, kind of introduced this to our providers. And of course, they're a little antsy about it in terms of this model. But we're going to do some one-on-one and some training with providers and, realize that we have not explained it as well as we should have. So just kind of backtracking and making sure that the providers are comfortable. And then also we spoke with Teresa on yesterday about our budget and some carryover and what we plan to do with that. So we're coming up with a plan for that. And Teresa will submit that to you on Monday.
Thank you so much.
Okay. So we're excited about moving along and getting everybody involved, but it's a little bit of hand holding, but that's okay.
Let me ask you, Dr. Ward Jones, would it be helpful if we had a psychiatrist who's been experienced in this model Zoom in to do some type of training or Q&A with your providers?
That will be really helpful. We have a provider meeting with all providers. I think it's the fourth Thursday of every month. So I'll get with you and we'll see if we can arrange something, maybe this month, next month. But I think that needs to happen, and for us to be successful, with our providers and making them comfortable, because it's different. It's definitely different. So they're complaining about having to do too much, but providers, we always complain. That's what we do.
You're always busy, so we get it. We get
Right.
it.
So yeah, I'll get with you and see if we can arrange for that though.
That would be great. Yeah, we would love to do that. One of the things, so you're right, it can be really challenging to get that provider buy-in. And so sometimes when they hear about it from people who have been doing the model and who they can talk about, well, here's my hesitations, here's my growing pains, here are things that, are making it easier. This is what I found to overcome those challenges. Sometimes that can be helpful. And, it's a way for peer-to-peer learning. And so I think that could be really helpful.
Yeah, that'll be helpful. And I think I want them to embrace this as, something that will help them in their daily workflow and to take better care of patients. And not everybody can go to the psychiatrist, or, not everybody needs to go, and nor can they go. So I think, that approach is going to be good in terms of someone who's lived the world and, found it a best practice.
Absolutely. Thank you for sharing.
This is Bree with Mercy, and we're over in Northwest Arkansas and Fort Smith area. And I think because we are so much larger, I think that's been, kind of made some things a little bit more challenging, but that provider kind of buy into the program. I think that's so important to make sure they fully understand how it works and how that billing works. It's so different from traditional fee-for-service. It just takes so much for them to fully understand what, and even just the office staff as well. Because when we do the training, we also train the office staff, because 9 times out of 10, the office staff is the one who's talking to the patient more than the provider even is. And it's a little bit more of a candid conversation. And you can usually get a better read on what's going on with that patient. So it's really just looking at everybody and trying to make sure they all understand what this program is, how it works, and just have that education piece in the background. That you just can't do enough of that, in my opinion.
Thank you, Bree. And you guys have been working on your CoCM project for a while, right?
Well, we're now in all of our primary care clinics, women's health clinics, and pediatric clinics in all of Missouri, all of Arkansas, and all of Oklahoma.
Wow.
So it's over 300, just over 300 clinics and almost 1,500 providers.
That's amazing.
But that's why that education piece is so important.
Absolutely. I had no idea it had grown that much.
Yeah, it's ginormous at this point, in my opinion.
That's fantastic. Thank you for sharing. So we could hear from Bree and this large system, it's possible, and how they've implemented it into almost all of their primary care clinics at this point. Wow, it's phenomenal. Any other comments or words of encouragement for Mindy as she starts to think about embarking on the CoCM path? All right. Well, I'm watching the clock. I just want to remind everyone that there is a mental health legislative work group that's happening next Wednesday from 9 a.m. at 9 a.m. I don't know when they will end because that's always a surprise. Um, and I don't have the room pulled up in front of me. Caitlin, if you could help with that. And Caitlin's going to be giving these announcements in a minute, but just wanted to encourage you to please join if you're able. And it's an opportunity for you to advocate for CoCM, um, as well as any other things that you want to advocate for, because we know Medicaid codes still have not been turned on for CoCM in Arkansas. And we know that Medicaid patients make up about a third of our population in Arkansas receiving health care. So just wanted to remind you that will be happening. And that with that, I'm going to pause and turn it over to Caitlin for announcements that are coming up.
Sure. Just to build on that work group, don't feel intimidated by any of that. I mean, it going to the Capitol and sitting in front of your government can feel pretty intimidating, but it is actually a pretty relaxed meeting, and they really are looking for our input. And I feel like a lot of good has come out of this work group in the last 2 years. So if you've got time, it's a monthly thing. Come and talk to like-minded folks and see what we can do in order to increase access in Arkansas to mental health. So just want to encourage you to come to that. And if you can't make it in July, we'll have it again in August. So let's see. Okay, I'm going to try to share my screen. Hopefully the right thing is up. All right. I've had about 20 tabs. Okay. Most of the things that I'm bringing to y'all's attention have already been mentioned. This is just kind of a recap. Tisha sent out the link for it, and then Kim mentioned it today. But this is just the webinar that happened this week from AIMS, reflecting on 20 years of collaborative care. Their recording is on their YouTube channel, and it's phenomenal. It goes through not only the history of it, but also how they implemented some of their research programs and how they continue to provide TA assistance for several clinics across the country, and especially for those that are starting or looking at ways to implement this. I took notes, and I've been in this space for the last 10 years, and I took notes on that, and it was just great. So if you have time to listen to that and throw that on while you're cooking dinner tonight or something, I think it is worth your time to look at. Okay, let's see if I can get to the rest of my stuff real quick. I don't know why it's not letting me see that. All right, let me try it again. Okay. Kim's mentioned our webinar from yesterday, if I'm remembering correctly, was on the digital solutions for integrated behavioral health. That actually is not up yet on our YouTube channel, but should be up, I think, within the next day or so. And you'll be able to access it. Again, phenomenal. He was able to answer, or he gave a great presentation and was able to answer additional questions that came from the audience just on how we could possibly use AI to help us catch more patients, and just have a more sustainable population health approach to this type of model to integration. This was a conference that's happening in Washington, D.C. If you've never been to D.C., it is a fun time. So if you are looking for an excuse to go, here's one. This is a conference put on by the ACU, and it is a discussion about integrated health and advancing that. Sorry, I don't want to scroll too fast. I know that gives people headaches. Trying to make sure I'm on time here. We also have some stuff going on here at home in Hot Springs. In August, there is the 50th Annual Behavioral Health Institute Conference, which is jam-packed with all kinds of presentations, but there are several on integration. So if you're looking to get even more education on that, Hot Springs is just a quick drive for many of us, and it is a beautiful town. So that's probably a good one to go to as well. I did bring up UAMS's schizophrenia conference. Michael's already mentioned that. I am signed up to go, and I'm excited. I don't think I can learn enough about that realm of mental health care. So that is available to register for, and I believe Misty put it in the chat. Again, just mentioning the CFHA conference. I know many of us on the call are going to be there, either presenting or in attendance. And they, of course, the whole thing is about integration. So they will have many opportunities to learn about the process and then the data that goes into it. And then finally, we do have, I say we, Dr. Verna Little will be presenting with a couple of her colleagues with the American Medical Association next week, actually, on billing, on CPT code sets for integration. So this is available for registration now too. In fact, I can probably put that in the chat for you to be able to do it. It's a very long explanation, but honestly, if anything that has Verna's name on it, I'm going to it. So it is definitely going to be something good, and we can all learn more about billing. As Kim said earlier, this whole billing situation with this is going to be kind of a grant long learning opportunity. So I know I went through those really fast, but those are always going to be on our notes and our minutes that Misty sends out. Usually by the end of the day, and you'll be able to access those links from there as well.
Awesome.
Bria, I feel ya, because I am usually missing everything too during the summer.
I should be there in October though. That one I think I'm going to.
Oh, that's great.
Fantastic. Okay. Well, right on time, Caitlin. It is 12:59. We want to make sure that we end on time and respect everyone because we know it is hard to get from meeting to meeting. Thank you for your time and thank you for being part of this project. We are so excited to see the movement for CoCM in Arkansas. I feel like we're making progress and that's fantastic. And it's just going to continue. We have lots of great people supporting each other and supporting this work. Thank you all for being here, and we'll see you next month.
See you,
Everybody.
Thank you.